I will begin my public address about giving you reasons why the single-payer healthcare system is the best system. I will first talk about some problems with the current system in the United States. I'll then compare it to other systems across the world, and then I'll respond to criticisms of the single-payer healthcare system, and finally, I will conclude my speech. As Walter Cronkite once said, America's healthcare system is neither healthy, caring, nor a system. Healthcare is a human right. Achieving universal health coverage for all U.S. residents is paramount to the well-being and progress of our nation. Today, over 43% of Americans cannot adequately afford sufficient care, and even less can afford quality of care. Thus, the only fair and equitable system is a public single-payer system. As such, the excess in national health expenditure, which is the total amount of money we spend on medical services throughout nationwide, can be appropriately addressed through a system that values the well-being of patients over GDP. Excuse me. With universal healthcare, patients wouldn't be incentivized to not place the burden of cost over the quality of care. Alongside single-payer systems, tax dollars work for everyone. We're through government partnerships and provider organizations, not just the top 1%. And this will allow medical facilities to be able to appropriately provide treatments based on need. And the single-payer healthcare system can also reach benefits by resolving disparities in coverage for mental health and substance abuse disorders relative to medical and surgical services, which is more likely in a single-payer model. Furthermore, there is a moral imperative to implement a single-payer model to better address inequalities rooted in social, mental health, and economic conditions. So going on, the greatest systemic barrier to universal health care in the United States is lack of insurance. Providing universal health services without significant economic challenges, the most significant reason for lack of adequate coverage is also the most prominent driver of the average medical across the nation. Additionally, the high cost of healthcare is worsening disparities that result in premature death and intersects with race, socioeconomic status, and disability. From 2003 to 2014, the high deductible health plans proliferated, saw an overall increase in the United States where spending slowed down. Healthcare expenditures for the wealthiest quintile grew by 20%, whereas it fell for the lowest quintile by 3.7%. And this indicates a clear disparity in economic status in terms of like actual resources in the healthcare system. And additionally, despite the Affordable Care Act, there are also continuous racial health disparities in the uninsured population. For example, in 2019, the percentage of adults not qualified for Medicare was about 7.8% for white, 11.4% for black, 20% for Hispanic individuals. Excuse me. And as a result, there are racial and ethnic disparities in receiving appropriate care. Without universal health care, health inequalities are exacerbated based on citizenship and immigration status. And this has a profound impact on marginalized communities seeking a better life. Going on to comparing to nations around the world, the U.S. Far exceeds others when paying for medical care. For example, the national health expenditure, or actually going back, so the United States residents spend more for U.S. prescription drug costs than any other country. It was total U.S. prescription drug costs reached about $335 billion in 2018, which is a 28% increase in a decade. And the growth is expected to increase to 67.3% to $560 billion in in 2028. And then in 2018, the annual per capita U.S. prescription drug cost spending was about $1,221, and that's well above the next highest spending nations of the UK at $526, Sweden at $534, and Germany at $884. Prescription drug expenditures will also represent 19.7% of U.S. GDP by 2028. And going on, out of 36 nations in the Organization for Economic Cooperation and Development, the U.S. spends the most by far. Despite using fewer healthcare resources, the country spends $2,000 more per person than the next highest spending countries. And this further indicates that the single greatest driver of healthcare costs, that the pricing system is the single greatest healthcare cost, is the single greatest driver to healthcare costs while providing fewer resources. Going on to respond to some common arguments against a single payer system. First, the most common argument is that single payer healthcare systems stunt medical innovation, whereas private systems don't. And this is just untrue. For example, single payer healthcare systems can inspire innovation through government partnerships and financing offers, which incentivizes medical innovation. Additionally, single-payer systems improve the quality of competition by removing health insurers. Currently, the market is extremely volatile because of health insurers, which raise the price of prescription drugs and medical services. And this has profound impacts on the consumer and is ultimately extremely harmful. Another common argument is that it's too expensive for the government to maintain or to fund. And this is just wildly untrue. For example, our national health expenditure, the current national health expenditure, would be more than willing to cover it, and there might be marginal increases in funding, but nothing excessive. Additionally, the single-payer healthcare systems have been known to reduce national health expenditures over time. This can be proven in the United Kingdom and Germany. Additionally, the United States federal government ought to implement a universal healthcare system. While millions of Americans suffer every year, unable to afford quality healthcare, we have remained complicit with this mass exploitation. In addition, the normalization of such egregious system is unfathomable. After exploring the depths of and arguments for or against, the only logical assertion that can be made is one that respects the universal right to affordable healthcare. Yeah, thank you.